this is Garrett Ball with 65Medicare.org. Thanks for watching today. I'm going to be doing a tutorial for how to compare Medicare Part D prescription drug plans using Medicare.gov. Before we get into that, I wanted to first go over briefly some important upcoming dates. The first important date to know is October 1st. On October 1st, that day will be the first day that the 2023 prescription drug plan information is available on Medicare.gov. Prior to October 1st, the information you see on Medicare.gov will be for the 2022 prescription drug plans. On October 15th, that is the first day you can make changes to your Part D coverage for next year. The last day you can make changes would be December the 7th. So the annual election period runs October 15th through December 7th. Any changes you make during that period will take effect on January 1st, 2023. So the plans run with the calendar year. Changes made during the annual election period take effect on January 1st. Now let's get into the tutorial for how to compare the plans for next year. Okay, so here we are. We're on actually our website, 65Medicare.org. I'm going to X off of that and go into Medicare.gov. So that's your starting point for comparing the Part D plans. Go to Medicare.gov. You'll notice the homepage for Medicare's website looks a little different than it has in years past. They've changed several things about how the comparison works, but we're going to go through that now. The easiest way to start is to go down to Find Health and Drug Plans and select Find Plans Now. When you get to this page, you'll see, if you're logged in, you won't see this part of, obviously. And if you don't have an account, that is something I would recommend creating an account. What that does is it enables your information to be saved in the Medicare.gov system. So once you enter medications once, they'll always be there. It'll save you time for future changes or future times you want to take a look at your coverage. I'm going to start, I'm not going to create an account, I'm just going to start with a zip code here, and then I'm going to select Drug Plan Part D, click Apply, and click Start. That takes us into the next question, which is, do you get help with your costs from one of these programs? If you do, select it here. If you don't, you can just select I don't get help or I'm not sure to move to the next screen. Next question, do you want to see drug costs when you compare plans? Yes, that's why we're here. Yes, and next. Next page is where you enter your prescription drugs. So I'm just going to type a few medications in just to give us a kind of a baseline for comparing the plans. So it'll show some costs. Let's type in a really expensive one here. Say if you type a brand name medication, it's gonna prompt you and say generic is available, and it'll ask you, do you use the generic or the brand name? It's very important that you are accurate about which of those you use, because that obviously has a huge bearing on the cost and which plans will come up as the best. So we're going to just enter those two. Once you've entered all your medications, you go to Done Adding Drugs. That'll take you to the pharmacy screen. On the pharmacy screen, you can select the radius for the pharmacies. You can adjust that here. I always select mail order just because I would want to see, how much the savings is, if there is a savings, for choosing mail order. Now I'm going to select a few different pharmacies. You can actually select now up to 5 different pharmacies. It is a good idea to do that even if you have a certain pharmacy that you're using now and prefer to use. The reason why is because the costs vary considerably from pharmacy to pharmacy and depending on which plan you have. Some of the Part D plans now have preferred pharmacies. The costs are a lot lower at those, obviously. So it is a good idea to take a look at multiple pharmacies. The next page, it'll actually rank the plans in order of lowest drug plus premium cost. So what you're seeing now, the cost is only for the rest of 2022. If you do this on or after October 1st, you're going to see the numbers for 2023. So anything you do prior to October 1st is not going to be accurate for next year. After October 1st, you'll see these numbers will reflect the premium for 12 months, plus the copays for your specific medications at the pharmacies you chose for the next 12 months. To look at plan specifics, you would click on plan details. This will take you in a more detailed look at the options. You can see some of these pharmacies are completely out of network. So like on this plan, if you really prefer to use one of those pharmacies, this plan obviously probably wouldn't make sense for you. So that would be a way to look at the more detailed results. If you want to compare multiple plans side by side, you can just click added to compare. You can do up to 3, and then you can do compare. This will show you a side by side of the 3 different plans, including what the total cost is, what pharmacies are in network and preferred. And if we go back to the plan results here, you can also filter by certain insurance carriers or star ratings. So this is really how you want to look at the details and the specifics of which plans cover your medications the best. We would always recommend, doing this comparison, particularly if you take any medication, so you can see exactly which plan is going to give you the lowest cost for 2023 for your specific medications. I hope this has been helpful. If you have any questions, please don't hesitate to reach out to us. My email address is Garrett, GARRETT @65medicare.org, or you can contact us on our website, 65medicare.org, or by phone. So thank you for watching our video, and hope you have a great day.